Shortly after Nancy was diagnosed with ovarian cancer, she came to me and said, "Jim, this didn't have to happen. This test is critical for people to get. What can we do about it?" And that's where Check Your Genes was formed. We wanted to focus solely on encouraging people with a family history of cancer to seek out genetic counseling and testing.
There are many cancers that can be considered hereditary. The most common patients we see are patients with breast cancer, colon cancer, ovarian cancer, uterine cancer, and certain skin cancers and prostate cancer.
When one does have a BRCA mutation, in the female specifically, they have an 87% chance in their lifetime of developing breast cancer and up to a 54% chance in their lifetime of developing ovarian cancer.
In this situation, knowledge really is power. Knowing your own genetic makeup gives you the wherewithal to find the best treatments for you. Our goal here is to try and find cancers when they're small and we can have the best outcome by treating them.
The actual testing process is quite easy. Typically we do a blood draw. We send the blood away. Based on technology improvements over the last few years, is we're able to look at sometimes 50 or more genes all at one time, because there are quite a few genes associated with hereditary cancer. And then within 2 to 4 weeks, we typically have our results.
Genetic counselors often were the first people to sit down with a patient and really explain, what does this mutation mean? How will I use this information to determine perhaps personalized surveillance, risk reduction roles, even prophylactic surgery.
After my diagnosis, I was referred to genetic counseling and tested positive for BRCA2 mutation. I was very fortunate that my cancer was caught very early. I'm very grateful for being able to share my story with people.
Our organization is laser focused on one mission. Our mission is to encourage families who have a family history of cancer to seek out genetic counseling and get tested. And we think that will save lives, and it has.
I got the phone call that I never thought I would get, and it was my father calling to say my mom was diagnosed with ovarian cancer. My mom learned about testing, and she was able to warn us, and I was able to have surgery to prevent cancer. And I'll live a long, healthy life, and my children won't have to think about my mom had ovarian cancer or my mom had breast cancer.
My mother had a big family, and she lost a lot of family members to cancer. Mom was tested, and we found out she had the BRCA1 gene mutation. Turns out my sister and I did test positive for BRCA1 gene mutation. That was really difficult to hear, but I was somewhat relieved to know, and then I could make some choices for myself. I looked at my mother's family and thought, cancer is how I'm going to die. I don't feel that way anymore.
I think the most important thing that patients should understand about hereditary cancer is that the results can affect not just you, but your family members.
Do you have a mutation? If you do, you have options available to you, can be proactive.
If you're tested positive, it's not a death sentence. It's just information.
Knowledge is power.
There are services available through genetic counselors and their clinicians.
We can save lives by letting people and physicians and nurses and everyone know the importance of hereditary cancer testing.
So what can you do to help check your genes? You can talk to your friends and family about their family history of cancer. You encourage people to seek out genetic counseling and testing. You can donate money. You can volunteer. You can be a member of the board. Join us in this fight. It's for you, it's for them, it's for us.